Studies among doctors in India shows the life expectancy of doctors is almost 10 years lower than the common population. Overweight, obesity, and lifestyle disorders are so common among doctors. Lack of exercise leads to sarcopenia and osteoporosis. In sedentary life, lean mass-fat mass ratio get altered even in a person with normal weight or BMI. We may wonder why the people with normal weight also get lifestyle diseases like heart attack, stroke, or cancer. The reason is excess fat accumulation and change in lean mass-fat mass ratio, along with the deficiency of one or more nutrients and excess toxins entering the body through food, medications, and cosmetics. Why doctors with good knowledge on medical care and accessibility to best treatment die earlier than a common man? It is time for doctors to think why our health and life expectancy is going down. It is easy to take a tablet than to take the effort to get healthy food and do exercise. So we go for the easy solution and stick to medicine. There are doctors who start antihypertensive to safeguard the heart from the late 20s, reaching 3-drug regime by the age of 50. If a doctor is taking drug for primary hypertension and type 2 diabetes himself, instead of diet and exercise, his inclination to promote lifestyle correction in patients will be less. Rather, prescribe drugs instead of promoting lifestyle correction. These drugs may keep the blood pressure and sugar low, but may damage cells throughout the body, leading to weakening of the immune system, DNA damage, mutations, and finally, autoimmune diseases, inflammatory diseases, cancer, or organ failure. We as doctors, if not able to keep a healthy lifestyle, we will not be able to motivate our patients to a healthy lifestyle. Cell activation treatment is a new approach in healthcare based on modern medicine developed by myself. The health benefit of this treatment method are achieved by ensuring optimal nutrition, optimal stimulation, and protection from toxins to each cell of the body. The goal of this approach is optimization of health, which include treating diseases, prevention of diseases, promote healing and recovery by strengthening the immune system and provide optimal circumstances for growth, development, and repair of cells. This healthcare approach has a role in prevention and treatment from congenital anomalies to cancer, psychiatric disorders to psoriasis, pimples to balding, weight loss in obese, and weight gain in underweight, etc. If you incorporate this approach into the conventional treatment of patients of your specialty, recovery will be faster, more effective, and complete. The use of long-term medications and surgical interventions can be reduced drastically. Before elective surgeries, if we prepare the patient with a cell activation protocol, the risk of anesthesia and surgery can be reduced to a large extent, and post-surgical recovery will be safe faster. Actually, 2 observations inspired me to develop cell activation treatment. First is, if only we could give every individual the right amount of nourishment and exercise, not too little, not too much, we would have found the safest way to health of Hippocrates, the father of modern medicine. Next is my own observation that Most of the drugs we prescribe to treat various diseases, including painkillers, anti-inflammatory medications, anti-allergic medicines, etc., act by blocking the pathway of the omega-6 fatty acid, arachidonic acid, derived eicosanoids at various levels. There is a parallel omega-3 pathway opposing the omega-6 pathway. This omega-3 fatty acid EPA, or the eicosapentaenoic acid, and DHA, or docosahexaenoic acid, derived eicosanoids and docosanoids, the anti-inflammatory or the healing pathway, is also blocked by these drugs. These eicosanoids and docosanoids have different functions in different tissues. That is the major reason for side effects of medications like arthritis medicine leading to asthma or increasing the possibility of heart attack. The latest scientific evidence shows eicosanoids and docosanoids function in diverse physiological systems and pathological processes such as mounting or inhibiting inflammation, allergy, fever, and other immune responses, regulating abortion of pregnancy and normal childbirth, contributing to the perception of pain, regulating cell growth, controlling blood pressure, and modulating the regional flow of blood to tissues, regulating brain activities, emotions, etc. In performing these roles, they act as autocrine signaling agents to impact their cell of origin, or as paracrine signaling agent to impact cell in the proximity of the cells of origin, or as an endocrine agent to control the functions of distant cells. Latest scientific studies also shows that human beings evolved on a diet of omega-6 to omega-3 essential fatty acids ratio around 1:1, whereas in modern diet the ratio is around 15:1 or higher. Final control of the cellular functions from skin cells to brain is under these omega-3 and 6 derived eicosanoids and docosanoids, which has a mutually opposing and parallel pathway. So, the ratio of omega-3 and omega-6 fatty acids in your food and body is crucial for health. Benefit of cell activation treatment is the result of achieving the essential fatty acid omega-3 and omega-6 ratio to 1:1 in food and at cellular level. Major part of the cell membrane is made of phospholipid bilayer. The omega-3 fatty acids EPA and DHA and omega-6 fatty acid AA and GLA incorporated on the phospholipid bilayer are metabolized to eicosanoids and docosanoids and act as cell signaling molecules. Optimizing the balance of these two essential fats is crucial for optimal functioning of cells. Cells are continuously replaced in the body. Optimal nutrition with a high content of omega-3, 6 and 9 fatty acids in optimized nutrient composition ensure incorporation of more of this long-chain polyunsaturated fatty acids in the cell membrane in the newly formed cells instead of saturated fat and trans fat. Polyunsaturated fatty acids like LA, ALA, DGLA, DHA, EPA, AA, GLA, etc. make the cell membrane flexible and exchange of nutrients and metabolic waste easier. Saturated fat and trans fat make the cell membrane stiff and make the cellular aging and replacement faster. Faster replacement of cells in the body leads to faster aging of the body due to telomere shortening with each cell division. Telomeres shorten when each round of cell division, and this limits proliferation of human cells to a finite number of cell division by inducing replicative senescence. Nutritional deficiency, oxidative stress, and toxic load make the telomeres shortening faster. There is growing evidence indicating that telomere shortening limits stem cell function, regeneration, and organ maintenance during aging. As a gynecologist and obstetrician focusing in infertility management, I have found correcting nutritional imbalance and reducing body weight in overweight and obese patients invariably increase the pregnancy rate, reduce the chances of abortions and pregnancy complications regardless of other supportive treatments. Even the structural congenital anomalies like cleft lip and cleft palate, hemivertebrae and kyphosis, etc., detected at anomaly scan at 16 to 18 weeks get corrected within 4 to 8 weeks with optimized nutrient food. The above observations encouraged me to think of a safe and comprehensive solution for the current health issues, incorporating latest scientific knowledge into Hippocrates' vision of safest way to health. Solving the practical problem of providing enough nutrition, not too little or not too much, to every individual in this era of sedentary lifestyle, increasing obesity and inflammatory disorders are solved with the development of low-calorie, high omega-3 fat with omega-3 to 6 fat ratio 1:1, optimized nutrient compositions, which include optimized nutrient food, optimized nutrient oil, and optimized nutrient salt. Anything other than a nutrient is considered a toxin by the body, including the drugs we use as medication. Any nutrient in excess is also a toxin. Special emphasis is given on not to add any preservatives, color, flavor enhancers, tastemakers, etc. in optimized nutrient compositions to reduce toxic load on the body. In this treatment protocol, patient can stop medication for type 2 diabetes on day 1 and taper off other medications for dyslipidemia, hypertension, fatty liver, uric acid, etc. gradually based on symptomatic improvement and laboratory evidence. Therefore, toxic load on the immune system, liver and kidney can be lowered. Repair of damaged cells and recovery becomes easier with a stronger immune system, and accelerated healing occurs effectively via omega-3 mediated healing pathway. Next challenge is to provide enough exercise, not too much or not too little in this era of sedentary mechanized lifestyle. Oxyflex cell stimulation protocol is designed to give stimulation to all the cells and body parts in a systematic way without straining any body parts while lying down on a comfortable mattress, in 20 to 40 minutes. It will not give strain to knees or heel in obese. So is suitable for obese and people with leg discomfort or disability. Fastest way to improve health is to correct patients' body composition. Illness develops as a result of change in the body composition. If someone wishes for good health, one must be ready for the necessary correction at the root cause, the change in their body composition. Cell activation treatment protocol is a safe, simple, easy and effective way for body composition correction and therefore the safest way to health. Optimizing the body composition and maintaining it at optimal level is the only challenge the patient has to take for a long-lasting result. Optimized nutrient composition are designed in such a way to support all medical diets like DASH diet for hypertension, low carbohydrate diabetic diet, keto diet for epilepsy, low calorie weight loss diet, renal stone diet, casein free diet, lactose free diet, gluten free diet, detox diet, etc. It goes well with all ethnic diets like vegan diet, Jain diet, vegetarian diet, Mediterranean diet, kosher diet, halal diet, non-vegetarian diet, etc. There is no added colors, preservatives, tastemakers, softeners, flavors, etc. in optimized nutrient food which make it safe. You are most welcome to know more about cell activation treatment protocol and how it can help your patients for better care and cure in your specialty of practice and also to keep your health optimal. Together, we can make a healthier nation and a healthier world.